Reversible pulpitis. Definition: it is a mild to moderate inflammatory condition of the pulp caused by noxious stimuli in which the pulp is capable of returning to the uninflamed state following removal of the stimuli. So it is caused by noxious stimuli. When we remove that stimuli, it is back to its original state. So it is called reversible pulpitis. Next, moving on to causes. In trauma, maybe a blow or a disturbed occlusal relationship causes reversible pulpitis, or maybe a thermal shock while preparing a cavity with a dull burr or keeping the burr in contact with the tooth for a too long time, and overheating during polishing a filling, excessive dehydration of a cavity or irritation of exposed dentin at the neck of the tooth, placement of a fresh amalgam, directly contact with a cast restoration also causes reversible pulpitis. Next, chemical stimulus as from sweet or sour foodstuff, or from irritation of a filling or bacteria as from the caries. So these are the causes. Next, moving on to symptoms. It is characterized by short, sharp pain lasting for a moment. So short, sharp pain lasting for a moment, and it is always specific to a stimulus. When we remove that stimulus, instantly relieving the pain. Pain is instantly removed on removal of the stimulus. It is more often brought about by cold than hot food. So we using a cold test also helpful in this condition. It is positive in for the cold test. We have to diagnose a reversible pulpitis. Next, moving on to diagnosis. We have to take the patient history and patient symptoms by clinical test. So patient, what is the history of patient? Patient have a sharp loss lost but few seconds to few minutes and disappear when the stimulus is removed, and cold, sweet, sore usually causes it, and maybe it is a chronic pain also. And in reversible pulpitis reacts normally to percussion, palpation and mobility. So, here the important point, when we tap the tooth in TOP, it is normal. There is no pain on percussion. And periapical tissue is normal in X-ray. No periapical changes in X-ray. Next, moving on to histopathology, it may range from hyperemia to mild to moderate inflammatory changes limited to the area of the involved dentinal tubules, such as dental caries. So only in that area we see the changes, that is hyperemia to mild to moderate inflammatory changes. Next, moving on to microscopically, in microscopically sees the reparative dentin, disruption of the odontoblastic layer, dilated blood vessels, extravasation of edema fluid, presence of immunologically competent chronic inflammatory cells. In differential diagnosis, we have to differentiate it's from the irreversible pulpitis. We have to take the pulp vitality test and symptoms of the patient. In irreversible pulpitis, it is a chronic pain, and is when we remove the stimuli, it also patient complains of pain. In next lecture, we will see the irreversible pulpitis condition. And next is treatment. Prevention is better than cure. We have to prevent the caries, periodic care to prevent the development of the caries. Next is when reversible pulpitis is present, removal of the noxious stimuli will usually bring the pulp back to a healthy state, and test for vitality is important. And next, prognosis is pulp is favorable if the irritant is removed. So these are the important points we have to remember in irreversible pulpitis. So it is caused by noxious stimuli capable of returning to the uninflamed state when we remove all the stimuli. And these are the causes. And in symptoms, short, sharp pain for a moment specific to a stimulus, instantly relieve on removal of the stimulus, and mainly it is sensitive to cold foods. And this is the diagnosis, histopathology, and treatment and prognosis. Question number 1. Acute reversible pulpitis is treated by option A, sedative filling, wait and watch. Option B, pulpectomy. Option C, pulpotomy. Option D, pulp capping. So acute reversible pulpitis is treated by. So the answer is sedative filling, wait and watch. So in acute reversible pulpitis, we have to give some filling and wait and watch. That is zinc oxide usually mostly given. Question number 2. Pulpal pain is most intense in option A, acute closed pulpitis, option B, acute open pulpitis, option C, pulp hyperemia, option D, pulp necrosis. So the answer is option A, acute closed pulpitis.